Welcome to this first episode of Guelph and Area COVID-19, a community in action. My name is Dr. Marcel Doré, and I've been a physician here in the Guelph area for about 30 years. The aim of this series is to highlight some of the wonderful work that is being done, not just in the medical community, but in the community as a whole through this COVID-19 crisis. I hope to highlight in future episodes many other people and organizations that are really helping us get through this time.
And so early on, like there was this high level of anxiety among all health workers. I could see it in primary care for sure, but as well with the system partners. And what's this going to be? How big is it going to be? Is this going to be as bad as SARS, worse than SARS? All of that stuff. And it was pretty evident to me that this was going to be a big one. And so we started to mobilize. Good thing we started to mobilize really early. And again, I remember the SARS days, and I remember looking at we all looked at the counts, how many were there. I remember the 32, and we used to know the numbers uh, every day, and you could sort of see it coming. So I think there was this sense of this looming crisis. We had resources that we could deploy. And early on, I have to say, our NPs in the system really stepped up, and our nurses. And they did a lot of the planning work with us, as well as some folks like me, around what it would take to get a clinic going. We quickly partnered with GGH and had some good help there. The city, the paramedics, the hospital, and the family health team had things ready to go. We were one of the first out of the gates in Ontario. Everything about this whole thing has been be ahead of it, and don't let perfect be the enemy of good enough. And that's the philosophy we've taken. And I've got to say, the whole healthcare community has really come together, and certainly the primary care community. Our NPs signed up. We have kinesiologists and dietitians and others working in the clinic, being patient greeters, being runners, being all of those sort of roles. So people it was mind-blowing how people stepped up, and heartening, I guess. So it's really been heartening is seeing how the community has come together.
Yeah, so last weekend we actually made the move and opened on Monday. And quite frankly, the facility is tremendous. A lot more room than we had on Dalhousie Street. And as a result, the capacity we have as well. Right now, we have it set up that we have basically more than double the capacity we had at the other one, but we can scale that up dramatically greater than that. And this was one of the design criteria is to be able to handle current volumes. And if things increase, we need to be able to increase. So we're very pleased. And the city's been excellent, hospital, all the family health team, and our nurse practitioners, Camille and Ray. There's been a tremendous amount of work by everybody to get this up and going. The idea of a surge is that as people interact with each other, this virus is extremely transmittable. So that if you can imagine, it's a little bit like a bubble. It starts with few people, and then every day more and more and more. And the growth is what we call exponential, so that soon there's this big bubble of people, like a huge number of people compared to where we began, that have the virus at any one time. And when that happens, it means that all of the things from mild infections to serious infections occur. And what happens then in the top of the bubble or the surge, we can be basically overwhelmed with the amount of sick people. Yeah, we're ready, and that is the surge, and that's what we've all been getting ready for. And I mean, certainly we're not cocky. We are not, but I think we all feel we're ready, and if this comes, we're ready for what is going to come at us. And I mean, we just can hope we're right, that we are fully ready if it does happen, and but we have prepared the best we can.
So
I think one of the message is family physicians in Guelph are still available for patients. I know a lot of patients are feeling like they don't want to overburden the healthcare system. They don't want to go to the hospital, but we are available. All of our offices are still open. We have people taking calls. Almost all of us are seeing patients either through telemedicine or on the phone, and trying to manage patients that way. So I don't want patients to feel alone, like they can't access their family physician. We're here for them, and we want to help them. And either sometimes it's just alleviating a worry or a stress or something that they're concerned about. And sometimes it's about a medication change or something more urgent has come up, and then we need to help deal with it. So that we're here for them, and I hope that they will reach out to us.
With that. So it's been tremendous. So there's been this incredible deployment of doctors away and into the assessment clinic, but they're also being ready to move to the hospital, and we have lists of our doctors who are ready to redeploy to back up emergency, back up the operating room and with assists, to back up the wards and our hospitalists, the well baby and the family birthing units.
So what we're trying to set up at the community level is a safety valve for the Guelph General Hospital for patients to present who have not respiratory issues, but other issues that would otherwise need to be seen somewhere, either at the emergency department or in a family doctor's office. And this is really a group effort amongst all the family physicians in Guelph to come up with an ER diversion location where we can see patients, and we may be able to see them virtually through a phone call, but at least help manage their issues. And no, the answer to that is no, no, and no. As much as we want to get together with our loved ones, we just can't risk us infecting them or them infecting us, and then we go spread it around to other people. So we need to wait. We need to wait this out. We need to hope a lot that we can, by what we're doing, we'll flatten the curve and we'll settle things down. So it's a wait and hope scenario for me. So don't get together. Give your loved one a call. Or do a Zoom or FaceTime meeting, and have a glass of your favorite beverage with them.
There's many sacrifices being made by businesses and people who are laid off, but everybody's in this fight together, and it's amazing. And I'm really impressed with what we've seen. And there's no doubt in my mind that this social distancing and the fact that people are practicing good hand hygiene, and we're actually not opening businesses and congregating, all of these pieces are going to make a huge impact on whatever this virus ends up doing to our community. It will be many, many times worse if we didn't see this amazing response from our community.
Yeah, and the news can be scary, especially if you're seeing in hot spots. I think it's important what you said is to pull it back to the local area, because that's all you can control is your local surrounding. Look at the numbers that we have locally. Yes, we have cases. Yes, the hospitals are seeing cases, but we're actually doing a very good job locally. The hospital is not overrun. A lot of family physicians are seeing patients and helping them out. And I think people are doing a great job when they go for groceries once a week. They're social distancing. They're not having parties or get-togethers. And I think I really see the community changing and doing really positive things for one another. And I think if we can keep that up, I think we'll do very well.
First of all, it's so gratifying to see the level of support for healthcare workers from the public, and just that level of support for anyone, frankly, in the service industry at this point in time is so great to see. I think it's about staying the course. You need to stay the course. You need to, as hard as it is to stay home, you need, it's going to tax us, for the weeks to come. We're all getting cabin fever, but we have to do this. This is the only way we're going to stop it. And it's the only way we're going to protect each other.
Anne-Marie Zavak here. I want to give a big shout out to you, the people we serve, and to the healthcare providers who serve this community. I have watched as these amazing leaders have stepped up so quickly, one of the first out of the gate in the province of Ontario, to get your COVID-19 clinic up and running. It's a beautiful space. Thanks to these efforts, we are ready. I want to thank the Executive Director of the Guelph Family Health Team, Ross Kirkconnell, whose leadership on this has been remarkable. He rallied the troops and made this happen. To his core leadership team, nurse practitioners Ray de la Frenier, Camille Lukes, doctors Aaron Smith and Doug Friars, and to our community partners, the City of Guelph, our brilliant first responders, the Guelph General Hospital, and the Wellington Dufferin Public Health Unit. Your healthcare team is ready. Everyone has stepped up. It's a remarkable strategic plan. There is a solid, competent, compassionate ring of protection around you. I am so very grateful. Stay strong, be hopeful, and stay the course. Please, we've got this.